Everybody wants some sunshine, right? Hey, y'all. Welcome to another powerful episode of Black Beat Podcast. I'm your host, John Washington, the CEO of Flossin Media. Joining me today is my co-host, Alex Gabber-Hewitts, who is our small business navigator coach. Hey, Alex. Welcome. What's going on today, man? What we got planned here today?
All right. It's Alex Gabraab. Close enough, though. I'll take
Okay.
that. And today we are honored to have Shannon Singleton with us. Shannon is running for Multnomah County Commission for District Number 2.
Oh, that's our district, isn't it?
Absolutely.
Ah.
And this is the heart of Multnomah County and the heart of the city of Portland. So this is a pretty popular district. With nearly 30 years of experience as a social worker, she has dedicated her life to improving social safety net services, and she brings a wealth of knowledge and frontline experience that is essential for sparking the transformation our community desperately needs. Shannon's core values, striving for equity, staying accountable to the community, and showing courageous leadership are reflected in her impressive career. From providing direct services as the Housing Policy Advisor and Director of Equity and Racial Justice in the Office of Governor Kate Brown, Shannon has been a staunch advocate for those most in need.
Welcome, sister.
Yes.
Is that Gabber-Hewitts?
Gabraab, that's I gotta honor my grandfather.
That's okay, man. You're out on my way, but we're glad to have you here, Shannon.
Thank
Yes.
you. It's great to be here.
And so she was also the interim director of the City of Portland / Multnomah County Joint Office of Homeless Services, and she currently works for a Black-owned consulting firm in the Portland area that specializes in equity and community engagement. Shannon, welcome to the Black Beat Podcast. We're excited to dive into the issues and hear your vision for a better Multnomah County.
Thank you.
So talk to us a little bit, Shannon, about what you got going on here and what's motivating you to run for office.
Yeah.
And have you run before?
So I did briefly run for Multnomah County Chair during the last election.
Oh, we
I
didn't know
unfortunately
that.
had to pull out of the race pretty early. We had some health conditions going on, and I decided to spend time with my husband as he was recovering.
It's a good thing.
And so stepped out of the race and took the interim job at the joint office
Right on.
to help during their leadership transition. So I did that for about 8 months. But this is my first race that's, really I've been able to stay in for longer than a couple of months. So it's been just an awesome experience. I've gotten to talk with so many folks who I never would get to talk to if I just stayed in my little work world.
Yeah. Wow. So Alex, what you think? Do we give it a Black Beat pitch or do we get it the Portland beat and vibe?
We give it a Portland beat and vibe because
All right,
this is an info session, and we have our community and our listeners are desperate for information.
Absolutely.
And so one of our things here is to try to get out as much info as we can. So let's give her the Portland beat to it.
Got you. So Shannon, what motivated you to run again? Tell me.
So what motivated me was when Commissioner Jayapal decided to run for Congress and was going to step down. I felt like it was a moment in time that somebody who actually did this work on the front lines, who has been advocating and pushing for not only policy but budget investments for Black and brown people to step into a leadership role at Multnomah County. We're not often represented there on the commission, and I wanted to step into that space.
Wow. And so, they got some big shoes going on over there these days and some big issues. Tell us about some of the issues that you feel, especially around the housing, the homelessness, and the fentanyl crisis and that. I mean, because Multnomah handles pretty much so the mental health and the wellness aspect of the community. So what are some of your
Absolutely.
thoughts about some of these larger issues that we got going on? I mean, I understand that they have a budget over there these days of over $600 million. Are you happy about that? That's one of the biggest budgets they had.
It is, and that's primarily because of the supportive housing services measure at Metro and the funds that specifically were designed to provide support services to folks experiencing homelessness, exiting homelessness, or that we're trying to keep from homelessness, right? We've got a lot of folks a paycheck away from being in a shelter or being outside.
Yeah.
And so the county really focuses on that kind of work as well as the behavioral health care, as you indicated.
Yeah.
That's where I see we have some gaps. When I was at Cascadia Behavioral Health Care, I started the first mental health street outreach team, so clinical staff out on the ground engaging with people providing mental health services without having to worry about Medicaid paperwork on the front end. There's 6 of them for the whole county. And
Your background is in social work.
It
isn't
is in social
right on,
work,
girls.
yes.
That's what mine is too. I did mental health, but yeah, go for it.
Yes.
Yeah.
So I think we need more staff who can be out there on the street and actually engaging
Yeah.
people, as opposed to looking for folks to navigate their way to a clinic or to a shelter or to some other setting.
Wow.
This episode of Black Deep Podcast is brought to you in part by the University of Oregon. Mighty doesn't follow trends, it sets them. Be mighty, be Oregon.
Yeah, I mean, that's been a big topic, and we've been hearing from different commissioner candidates in bringing that to light, but we haven't really heard any practical plans, specific plans that are measurable and give us timelines, timeframes for what they're going to do. I mean, sometimes it comes off like you're highlighting the obvious. Yes, the city, the county, we all know we have these homeless issues, and they come in and say the first thing I'm going to do in office is get that cleaned up. We still haven't gotten a specific plan for how that's going to be done, and some of that stuff is kind of repetitive in terms of what's been done in the past. But do you have an approach that you're kind of thinking that may be a little bit different than?
Absolutely. Yeah. Again, I think because I've been on that front line, I know that gap is those mental health services on the front end. So I want to add mental health outreach staff to the programs. I also want to add peer staff and get more folks who have lived experience of mental health, addiction, homelessness out there and supporting people to get back inside. The other thing that I think is really missing is we have not done, and there was a recent study of an analysis of our shelters and the types of shelter. And up until that point in time, we had only had 1 quarter's worth of data that I had collected when I was at the joint office that was telling us people are exiting to housing more from alternative shelters than they are from congregate shelters. I want to actually unpack that and understand why, and if we need to invest more in alternative shelters, then we should do that, even if that means we're changing our contracts and not running congregate shelter. We have to be willing to change how we're funding things and not just keep doing the same thing when the data is telling us we're getting different results.
So when you say, what are some examples of alternative shelters?
Yeah, so like Dignity Village, who's been in our community for decades, they have tiny house shelters. They're a transitional campground. Right to Dream 2 is another a longer term safe sleep village. And then you saw during COVID-19, we opened a number of shelters that were the tiny pod village shelters that have now become, a couple of them became safe rest villages, and then additional safe rest villages were open. So they're all a little bit different in how they run, but they all are connected to housing placement services. And there's something about that privacy and security. We're also seeing that in our hotel motel shelters. We primarily do that with families. We're seeing better outcomes in a hotel motel than in our congregate settings. And so again, I just think we have to be willing to make those tough decisions. We don't end a lot of contracts in Portland or Multnomah County or change things from what we've done for a long time. And it doesn't mean that it feels good, but we have to be willing to make those tough decisions.
Yeah, absolutely. I mean, the biggest perception that I hear, and we always kind of hear all the time when it comes to those shelters, is there's a huge lack of communication within all those shelters, and there's a lack of central governance of that communication.
Absolutely.
So I don't know if that's something that you've seen, and if there's any plans around that as well. But
Absolutely. It's one of the biggest things I want to change is we used to meet as shelter providers. I ran the first low-barrier shelter in downtown Portland, and I used to meet regularly with the one other shelter provider who served women in our community. As we grew, those meetings shifted. And during COVID in particular, they stopped happening as the whole system really shifted to crisis mode. But they haven't been re-implemented. That was something I had started while I was at the joint office, but it wasn't followed through on after I had left. And it's something I hear the providers saying they desperately need. They don't even see the data for the whole system. So if another shelter is doing something that's working really well, they have no idea that's happening. And I think it's the county's job to convene those providers and have those conversations.
Yeah, that's kind of like where the frustration comes in for a lot of the people here, because they notice that lack of miscommunication, you know, not having the adequate software and all that stuff. It seems like we've been highlighting this issue within our city and our county for such a long time. You would think that there'd be a little bit more progress towards that, So I just got one more question for her, John. I'll let you take
for
it
it.
away
Yeah,
because I
yeah,
can tell
yeah.
you firing her up.
Yeah, well, I'm thinking about this homelessness. But go ahead.
Yeah.
I know that we spent $1 billion in the last couple of years in this one specific topic. I'm really curious as to what her thoughts are about where we're going from there.
Yeah, I mean, my only other question I had in regards to this is, are you guys looking at other models in different cities where there may have been some success? Because one of the things that I've been seeing is that having a precondition to qualify for a shelter is actually becoming a barrier for people. So becoming, drug-free, alcohol-free, and all that stuff is actually more of a barrier than not. And then when you look at cities like Columbus and then I think it was Salt Lake, they removed those barriers. They gave them housing without conditioning, and they seen a big improvement as opposed to having those conditions. Do we currently have a ton of conditions in place prior to getting housing, or?
It
Or
really
shelter?
depends on what program you go to. I do think, and people have said they do want and need recovery-based services. So I want us to maintain, particularly our transitional recovery housing, right? A lot of central city concern types of buildings, and that is important for folks who want to go through addiction recovery. We also do have and have changed a lot of our shelter system to low barrier, so there aren't requirements around sobriety, which can be hard for folks who do want to be sober. And so that's why I like having multiple options. We don't really have a true housing first model, which is what you were speaking about that happened in Salt Lake City. We know that the data tells us this is an effective model. It's part of what our intention is with the supportive housing services and with the housing bonds that were recently passed. It hasn't fully come to fruition. Part of the challenge can be lack of affordable housing units, even though we've continued to build. That are really affordable to our lowest income folks. These are people on fixed Social Security disability income, which is, I think, under $800 a month still. I don't know any apartments you can rent for that. And then our folks who have no income, who haven't qualified yet. We have to continue to focus on building housing for those folks, get them inside, and wrap support services around them.
Right.
It doesn't mean we don't do that in shelters too, but we've got to do both. I think we're not widgets, right? We can't set up a system where it's like you do this and this is your stepping stone into housing. We've got to allow people to define their path back inside. Some it's through shelter, some it's through recovery, some it's housing first, and we just really need all of them.
Well, Maxine said affordable housing in perpetuity is not really what we're after, right? But how do you begin to unpack the whole issue around race, demographic, and service provision, right? I was looking at some studies that showed who's been dying in the state of Oregon from fentanyl overdose, right? And the larger number is white males, right? And then when you consider the fact of affordable housing, not affordable housing, but just the crisis of housing itself, how do you begin to mitigate the issue around disparities, this whole issue around race disparity and all that, and then where the resources go in light of some of how this demographic stuff stack up? I mean, how are you going to begin to navigate some of that stuff? I mean, what's your thoughts about that?
I think we did some good expansion of culturally specific services, but we're not there yet, right? We need to have the providers who look like us out there serving the folks who look like us. Because we're still disproportionately homeless, disproportionately underserved in behavioral health care. I think I'd love to talk some more about the behavioral health education pipeline, because that's a whole other piece. But I think those culturally specific services are really key. The other is folks are going to engage with mainstream service providers, right? Especially in a shelter system. We have got to hold our mainstream providers accountable to culturally relevant services. If we're seeing that people are being barred from a day center at a rate that is higher for Black folks, then we need to be having a real conversation about that and monitoring the data and helping that agency to change their culture. That's what I think we're missing, is that the county staff and the contractors having the time and the space to really hold folks accountable to provision of services so that our folks don't keep getting left behind.
Shannon, as a candidate, I mean, do you have any thoughts on how we arrived to this crisis? I mean, obviously there is some history. I mean, I've been here doing this for about 30 years. I helped write the state's drug and alcohol ORs for this state and the state of Washington. But looking at the progression of mental health and service provision and all that stuff over the last, say, 20 years, is there a sense of how people know how we arrived to this crisis that we're dealing with right now?
I mean, a big factor is we never invested in the community mental health services that were supposed to be implemented when we deinstitutionalized mental health. Not everybody belonged in a state hospital. However, we never established a system that could serve them.
Right, and we started closing the state hospital down,
Yep.
and we just put those people out on the street and out
Absolutely.
in homes and stuff like that, right?
Yep.
Absolutely. One of my former supervisors when I first moved to Portland was actually a worker who for one of his first jobs was he would stand at the bus stop and meet people as they were being dropped off from the state hospital and try and engage them in services because otherwise they were just homeless. That's ludicrous.
Those
That is
issues,
crazy.
but the thing with the state hospitals, they were abusing a lot of those people in there, right? So
And it's not that the state hospital is the answer, but the community-based mental health and having mental
Yeah,
health
and having
centers,
beds,
that
yeah.
never happened. No
Okay.
beds for folks who
Right,
need a higher
right.
level of care.
Right.
It's very difficult. If you're
that's interesting you said, because I heard there's actually too many beds open right now.
Not in the state hospital, there isn't.
Not
Because
in
there ain't no
No,
state
like in
hospital.
group home settings
that
and the
was community-
adult
that was
foster home
community
settings.
that's
plan,
different.
right?
Okay.
Yeah,
that's
so
community-based.
the adult foster care and those group home settings aren't necessarily designed to serve people with severe and persistent mental illnesses, particularly if they're being untreated.
Okay.
So we're missing kind of that sort of bed, but we're just even missing the clinicians to do that work.
Yeah.
Okay.
And that's we have a huge glut in our behavioral health care workforce. And it's because partially the wages are so low that people can't even afford to live in the community they work. And so folks get their license. I did this. I went and worked for a community mental health provider. I did some of my time and I went on to something that was going to pay me more than $40,000 a year because I couldn't survive on that any
Not a little bit of
longer.
money, right? Me too. And even though we had the private practices out there, some of the medical insurances was just billing us. You know, we got down to 15-minute increment billing. I mean, we got from 45 minutes to 15 minutes. So, but now I understand a lot of the changes began after Margaret Carter left the mental health reality and all that, and started dismantling itself. What are you recognizing and seeing that? What are you seeing are some of the things that are occurring now that you believe would make some transformational changes in this system? Is there any things going on right now, or do you feel there's some things being added that should be added to it right now?
I think, the addition of a sobering center and a place where people can go to detox safely, I think there's more work to be done on what that looks like, but that's a good step in the right direction so that, again, people have access to that space. I would like to see us as clinicians actually get up out of our offices and do mobile services.
Yeah, I proposed that to the state mental health department. I said, black people are phobic to that white robe, man. You not to figure. You need to go out and jump and shoot a basketball or go to the house or something, man.
That was my office when I was in downtown.
Mine
I was
too,
over on the
yeah.
Parks blocks shooting hoops with my clients.
Yeah,
Absolutely.
me too. Marion County, I ran their crisis services for a long time. I'd go to the house.
Yep.
David, you can feed me, but I have a conversation with you while you're there. You make an assessment. You know.
Yes.
So we need to adapt to some creative realities. I agree with you, and I appreciate you bringing that lens. Because what I'm hearing is most of the people are bringing a political lens to all this, and I think we need representatives that actually have knowledge of the industry, of the business, of mental health and those things. And I think that, Shannon, you wear a really interesting hat in that. But tell us, from the educational and equity part of this, I mean, there are a number of aspects of this that is run through just the services, right? So, but what are you going to do about how monies are funneled into specific categories that are not rooted in crisis management? I mean, Shannon,
Right.
That's what I'm seeing is that where we're at right now is that the fentanyl is a crisis management. But I don't necessarily, when you look at the numbers, like I said, over 700 people that died from fentanyl poison, a large amount of them are white males, okay? Not that it matters what color they are. People are dying, so obviously there's a response to it. But what is your future thought about how we're going to be able to get our arms around this for a little bit and be able to sort of begin to manage to an outcome instead of just managing the crisis?
Yeah, it's very much in that how do we support people once they're inside, right? And that includes around addiction recovery, mental health recovery. But the other thing we're missing a lot from our anti-poverty programs is the access to education and or training to move into family wage jobs. We're doing a lot of crisis management, even in anti-poverty work, where it's about like, let's do some rent assistance so you don't lose your housing. But how do we actually set it up where those households are able to, I'd rather pay rent for somebody for 2 years while they finish an apprenticeship or training program so that they can become economically self-sufficient than for them to be in constant crisis. And trauma, right? That chaos of worrying if you're going to be outside is really intense, and we need to take some of that pressure off and get our folks into those family wage type jobs.
So Shannon, tell our listeners, what are you going to bring to the reign over there? I mean, if you're elected, what are you going to bring?
Yeah, so I'm going to bring not only those like some of the top program things we just talked about, but I think, and I mentioned courageous leadership. I am somebody who will stand up for the people that are most impacted, the most vulnerable, or the most left behind or pushed aside. And that's what I've done throughout my career. It has never been about me. It's about my servant leadership and how can I serve other people. And one of the examples that comes up to me is I met Miss Avell Gorley for the first time. When I was an intern at the clinic.
Senator,
She's amazing. And I said, I don't understand why we don't take Medicaid at the Avell Gordley Center for Healing if we're supposed to be serving Black folks. And she didn't realize that we didn't take Medicaid. And I wasn't sure if I was going to get fired from my internship, but it felt important to say, right? And that's something that I've done and will continue to do, is stand up and say things that might be hard to say or might feel unsafe to say in the face of dominant culture, but I will continue to stand up and say that.
What have you observed has been the history and pattern of Multnomah County that you're looking to go in there and change? Have you seen over the history of watching it? Does something prompt you to want to lean into this aspect of it?
Yeah, I think particularly the current rhetoric that seems to be going around, particularly around homelessness and folks with low incomes. It feels like there's too much of folks trying to score political points on the backs of poor folks. And I really felt like we just need somebody who's going to come in here, center them, center their needs, and actually get stuff done for the community. This is a 2-year term. It's a special election. Do I think I'll get everything done I want to get done in 2 years? Probably not. Would I consider running again? Probably. But I don't have long-term political aspirations. For me, this is really about the county is a social service provider, and I am a damn good social worker.
Hey, I didn't say you prepared for this time.
Yes.
You're a good choice for this time. Yeah, and Shannon, we do appreciate that. I mean, so is there any things you want to talk about, public safety, community justice, any of these kinds of things, while you're looking at a few of these things? Or is there something you might want to share about those things?
Yeah, I definitely want to. I am not the expert in anti-violence programs, but I have done some work with the Oregon Alliance for Gun Safety, and particularly their Black and Brown leadership table that is looking at how do we bring forward not just budget investments, but policies, local, city, county, state, that will really do better prevention in the Black community around anti-gun violence. I want to hear from them what their specific investment ideas are and what they need, because they're on the front lines of that work. So that's something that's important to me to stay connected with.
Wow.
The other piece I would say is, again, as the workforce, I really do want to continue to figure out how we're connecting people. I think the trades are such a way for folks to have good paying jobs. And you know as well as I, we have a bunch of infrastructure projects that could really get people into a good financial position.
And we could, but I think we need to prepare them. And I think Shannon, one of the things I'm cognitive of is this constant dependency models that we keep creating. And it's because when we're looking at disparity studies and all these things, I mean, it's really clear and blatant as to what the issues really are. But I don't know what it's about, the constructs that we are a part of, is that it constantly looks at dependency. And the minute we're talking about some independent models, I mean, the small business ideas, 86% of the support the state gets is from small businesses, right?
Yep.
But the bottom line is, look at where we're at right now. I mean, there's no real model, no plan, no nothing to support them. And they're in crisis just like fentanyl or anything else. Now, I can't quite understand why the governor won't declare a state of crisis in the reality of small businesses in the state. So there are a lot of things that we're trying to somehow or another mitigate and trying to somehow navigate and get on top of. But this one, I'm hoping that if you do get selected, Shannon, you get in office, is that I'm really happy to hear that there's someone that's knowledgeable about the need, okay? Because a lot of times we politicize a lot of social service needs, but we need somebody that really understands the end result. I mean, longevity, sustainability, those things, lack of no recidivism, all these types of things. And I'm not talking about just throwing money at things, understanding the process. So we're real happy to have you in the contention on this, Shannon.
Thank
and
you.
we're hoping that you pull this thing off that you're set after, because it's going to be real fascinating. And is there anything that you want to share in your campaign at this point in time to our listeners? What you might want to share with them that we might have not asked you a question about or anything like that?
I think just encourage folks to, if you have, one, please vote. It's important that we vote, even if you're not voting for me. I want you to vote for me, but please do vote. And I think the other is check out my website. I know that there's not a lot of people have got to spend time with me like you have, Mr. Washington.
Thank you very much.
So, check out my website at shannonsingleton.org. If you have questions, email me at info@shannonsingleton.org. I want to communicate with folks. I want them to know what I'm about, and that's all laid out there for them.
Hey, y'all, look it. You heard it right here on Black Beat, y'all. And we do appreciate y'all listening. Hey, Shannon, we appreciate you coming in the house. You hear?
Thank you.
And y'all, look here. Get out there and vote and do what you need to do, because we're in a state of a few crises around here. We need your vote. So get on. Hey, Mr. Gabriel Hewitt, my man Alex.
Go, Rob.
Gabriel. Any departing thoughts, my brother?
No, I'm super excited, and I think as we get more candidates up here, people are starting to become a little bit more educated on how this process goes, and the issues are all being repeated, right? Because we're all facing the same issues. So it's fresher breath air to hear that somebody who has your background and your experience is running. So good luck, and thank you for being here.
Hey,
Thank you.
y'all have a great afternoon. You hear? Thank y'all.